Hello everyone, this is Ben and welcome to my channel, Chapter 3 Retirement. So why Chapter 3? Well, when I look at life, it looks like a book to me, and Chapter 1 are the years where we're growing up, going to school and learning our trade, so to speak. And Chapter 2 are the last, 30, 40 years where we work using the skills that we learned and make a living, so to speak. And here we are, Chapter 3, Retirement. This Chapter 3, I don't know how long it is. A few weeks ago, I thought I only have 6 months to live because they found a lesion in my pancreas. And my first impression was cancer, right? Metastatic, because when you find a pancreatic cancer, it's late. It's probably, that's what it is. So yes, I don't know. This chapter could be 6 months, 6 years, or another 20 years. We don't know. And that goes back to making this video. Like I said, this is all about retirement. I have about 129 working days to go. So I'm working towards that. And, I'm a practicing physician. That's why the title here is a physician retiring. So what's the difference? I watch a lot of YouTube videos and they talk about, okay, 5 things to do before you retire, 6 things I found and things like that. For me, I'm still in the process. This is early, and I thought for me, my niche, my audience probably will be most likely people in healthcare. I've been in healthcare for about 40 years. And of course, there are also other people who may be interested to see what's going on with the healthcare professionals. There are 2 things I'd like to touch briefly in this video. One is what is the prevalence of suicide among physicians, right? I was curious about that. And another related topic, of course, is burnout. So I did some research last week, and it looks like physician has a higher risk of suicide actually compared to the general population. It says that in the United States, it's about 2-3 times higher actually. It is estimated that 300 to 400 physicians die each year because of suicide. And yes, female physician has 1.5 to 2.27 times higher risk of doing this, right? Then of course, just like any topic that we talk about in healthcare, why? What are the factors? Number 1 is workload and stress. Nowadays, things might be a little better compared to when I started. I started as a small town physician with 8,000 people where I deliver babies, work in the OR, do surgery, go to nursing home, go to ICU and everything, right? Those 3 years were really bad. And on the weekends that I'm not on call, I have to get out of town and go to another town, to another city where nobody knows me, no one's gonna call me. That's what I did. And of course, the next job that I had, I was doing everything, hospital work, office work, and things like that. Like now, I just come to the office, wait to see my first patient. But in the past, during that time, for about 2-3 years, I have to go to the hospital actually, see my patient before I come to the office. Sometimes at lunch, I go across the street, see the patient after work. And when I'm on call, sometimes I stay in the hospital admitting patient until midnight, go home, then might call me again, I may go back to the hospital. So those were, days where it was really hard. And over the years, a lot of things also changed. It became very stressful. I've been always an employed physician, and all these years, things have changed so much, in my mind, I don't know, I cannot speak for myself, I'm just a number, right? As a physician, my salary is twice the salary of a mid-level, meaning if I leave, if they fire me, they can easily get 2 mid-level to replace me, right? So stress. Number 2 is mental health, and that goes to what I talked earlier about burnout also. We're gonna talk a little bit more about that later. Yes, mental health. As we deal with stress, depositions, lawsuit, patient complaint, challenging patient, patient get pain medication, you do their drug screen, there's nothing there, right? So those are the stress that we have to deal with day in and day out. Number three, they talk about perfection or personality, actually, right? I always joke that as a physician, I'm OCD, I'm a perfectionist, because when things happen, when something happened that didn't come out with a good outcome, then I make changes. Next time I'm going to do this, next time I'm going to do that. A very simple example is FMLA form. People come in, just drop the form. Hey, let the doc fill that up. I don't. Why? Because one time I tried to help the patient without seeing them fill up the form. It messed up the whole thing. Patient was mad. So from that time on, no more, right? You want this form filled? Come face to face. We'll talk. We'll fill up the form together, right? And then the number four factor they mentioned was access. Yes, physicians have access to narcotics, benzos, all those sedative hypnotics and things like that. So yes, we have, or people who work in the hospital, they have access to IV medication and things like that too. So that was easy access for physician. And the last thing is the stigma and barrier. Burnout and all these things, I call it emotional disturbance, is a problem, because when we renew our license, there's always a question there. Are you depressed? Are you taking medication? Things like that. So as a physician who's trying to keep the practice, support the family, they're not going to say anything about it, right? Because it's going to be against them. Yeah. So anyway, those were the 5 different factors that was mentioned in the article that I read last week. Workload and stress, mental health, personality, access to lethal means, and also stigma and barriers. So the other one I want to mention is burnout. Yeah. Yes, in my 40 years of career in medicine, yes, I've been burned out a few times. In fact, about 10 years ago, I did see a coach, and he was a practicing family med doctor. He got burned out. He quit clinical practice and did this, workout counseling or coaching. I remember when he told me, he said, "Ben, burnout is not a problem. It is a dilemma." Right? What is the difference? A problem is like an abscess. You have an abscess here, you cut it open, drain it, get some antibiotic, it's gone, it's over. That's a problem. Dilemma is burnout is a dilemma, because you have to constantly balance. Do I take my vacation, or do I stay? Should I just go home or finish my work? It's a constant dilemma. We need to constantly, every day, see what's going on, what do we need to do, right? It's not like, it's okay. Another month I have a 1-week vacation, I should be okay. No, it's a daily struggle. It's a daily dilemma. It's a daily balancing act. So when I searched again last week, I came across something called the Copenhagen Burnout Inventory. So this was, it looks like the first edition was February of 2004, so about roughly 20 years ago. Interestingly, they divided into 3 parts. 1 is personal burnout, 2 is work burnout, and third section was a client, or in my case, patient, burnout. In the first section, there was like 6 questions, and there are 2 that stood out. One, it says here, how often do you think I can't take it anymore? That's one. The other one is, how often do you feel weak and susceptible to illness? And that's true. And for me, last year I ended up in a hospital because of a bad migraine headache, and that's after I changed job in summertime and all those things. So yes, susceptible to illness. That's one, right? The second section, part 2, as far as the work burnout, there's about 7 questions. I saw 2 that that kind of ring a bell, and that's important. One is, does your work frustrate you? For me, yes. Lately, I've been saying that I'm just a messenger. I'm just a secretary, right? Patient comes in, I want a referral. I want to see this doctor. And then my boss said, no. Don't refer. You cannot do that. It's money, so you cannot just refer. Just check it yourself, whatever, right? And as I tell my patients sometimes, I said, if you're my patient, we're in the exam room talking to each other. No, it's not just you and me. there's a lot of ghosts standing here that you don't see. Who are they? Pharmacists. Pharmacists calling me and say, hey doc, what is your treatment plan? Why are you giving this patient pain medication? The insurance company refusing your referral, right? And then my boss, the government, DEA, anyway, all of these people, they're telling me what to do. So I'm squeezed between the patient and my people controlling me, right? Patient satisfaction. That's another issue, right? So it's frustrating. The next one that stood out here is, do you feel worn out at the end of the workday? Yes, definitely. How many times do I go home, sit down at dinner with my wife and say, I'm so drained. I didn't do anything. I just saw 5 patients today, but I'm so drained. And yes, we're supposed to be compassionate. Patient come in, they're not feeling well. Yes, I'm a very compassionate person. The way I talk here is the same as the way I talk to my patient, right? And but a lot of times I feel like come in with a picture of compassion, and I just give it to all these patients who needs help. Then at the end of the day, I feel like a sponge that's being squeezed dry, and that's how it is. Yes, that's burnout. That's part of burnout. On the last section, they talk about a client burnout, or like I said, as a physician, as a healthcare professional, patient burnout. Again, there are 6 questions. There are 2 that I check here. Is that, do you find it frustrating to work with clients? Very. Or work with patients? Definitely. Nowadays, patient come in and say, I read something, my neighbor said I need to do this. My girlfriend told me I need to take magnesium and all these things. Patient come in with all this information, with internet, with cell phone. People just go to the internet and they know everything. They come in and say, I have this diagnosis, right? I remember vividly, I have a patient who was crying, 35-year-old guy crying. He said he'd been crying for 2 weeks. I said, what's wrong? He said, I have HIV. I said, oh, really? Did you get your blood work done? No? So how do you know you have HIV? Doc, I have all of these symptoms. I look it up, it's HIV. Right? So what did I do? Of course, send him for blood work. That's a straightforward, solution. Of course, it came back negative. And of course, he cried for 2 weeks for nothing, right? So yes, those are the challenging things that, we see in the office. The other one, it says here, do you sometimes wonder how long you will be able to continue working with patients? Yes, that's a question every day. I try to bring the horse to the water, but half of them, or more than half of them, don't want to drink the water. And then sugar is out of control, cholesterol is high, and then my boss is behind me. Hey, why is it not controlled, right? Every diabetic patient needs to be on cholesterol medicine. Yeah, I know, I'm a doctor, but where is my autonomy? You hired me as someone who has 40 years experience in taking a patient, right? Like I said, whenever I see a patient, I tell them, I'm here to help you with 2 things. Number 1 is I'm trying to help you not to end up in an emergency room or in a hospital. Number 2, I'm trying to help you not to suffer. Some of them get it, some of them, they don't care. Those who don't care, I say my thing, I say, nice meeting you, come back in 3 months and go for it, right? So, yes. People who stay in healthcare are people who care about people. We're not here for the money, right? People who are rich, they're not doctors, right? We're here because we want to help people. Yeah. And again, why is a physician retiring? Because system is bad. Remember the story about the frog being cooked, right? There's this frog in the water, right? Slowly, there's a fire underneath the water, slowly get up. They say, it's okay. Another year, I don't need to retire, then just wait, I just hang in there until one day the water got to a point where the frog cannot get out and just burn that and cook, right? So that's what it is. For this video, I'm just trying to, again, help myself understand why I'm going through this, why I decide to retire. And I'm sure some of you may have your story to share. I'm doing this section about physician because I am a physician, and that's one thing that I can share more. So maybe If you're a physician, stop and think about what I just mentioned. Is it time to get out? Because the system is not going to change. If you have a spouse who's a physician, have you stopped and asked that person, how are you? Are you okay? Do you need a break? You know, in the academic world, in universities, professors who teach after 7 years, they have 1 year sabbatical. How about in the medical field? Why don't we do that? You know, next time you see your doctor, of course, if he's not in a hurry, standing at the door and say bye, if he sat down and talked to you, yeah, maybe ask him or ask her, right? Hi, how are you? Did you take a vacation? Are you okay? You need to talk, all right? So anyway, I hope this helps. Chapter 3, retirement. I have 129 working days to go, and I'm trying to make this video as I go along. I hope it helps. If you have your experience, you feel free to put in a comment. And until we meet again, take care and bye. All right, bye-bye.